Good afternoon and welcome to our regular press briefing coming from Tobago, the Division of Health, Wellness and Family Development in the Tobago House of Assembly. And we are now going to be updating you as to where the health sector is in Tobago as regards to COVID-19. The speakers that we have today would be Dr. Tiffany Hoyt, who is the County Medical Officer of Health, Dr. Victor Vela, who is the Medical Chief of Staff at the Scoville Regional Hospital, the Secretary for Health, Wellness and Family Development, Mrs. Tracy Davidson Celestine, and Director of TEMA, Mr. Alan Stewart. In that order, they will present. My name is Michael Stewart, Communication Consultant. We welcome those of the media and those who are listening locally, regionally, and internationally. So we, at the right time after the presentation, we will open up the telephone lines for questions from the media. If you are viewing us on Facebook, then you can leave your question on Facebook or you can send us a WhatsApp. Yes, you could raise your virtual hand for those on Zoom so that we'll be able to take your questions and information. At this time, let me welcome and invite their first presenter, Dr. Tiffany Hoyt, CMOH.
To start by just giving an overview of the statistics for us here in Tobago. So with respect to date, with the number of samples submitted to CARFA for testing, we've submitted 85 samples for testing. And just to note that this percentage per capita is actually more than twice the amount submitted in Trinidad. The number of samples that tested positive from these samples would be 5. The number of deaths recorded in Tobago would be 1, and the number of persons who have completed quarantine at the division's quarantine facilities would be 65 persons. So just to note, all persons at the quarantine facilities have been discharged home, all 65 persons. While in quarantine, 5 persons would have developed symptoms and were tested. Of the persons who were tested, 2 of them were tested. Tests came back positive for COVID-19, and 3 of the tests were negative. With respect to our 4th positive case, this person was picked up by our mop-up operations. So for persons who had returned from international travel and had managed to slip through the domestic air bridge because they returned via Piaco and then came back to Tobago via the domestic bridge, we ran some mop-up operations to find and to monitor these persons. The individual had quarantined themselves away from their family, thankfully, immediately upon arrival to Tobago. And when they were found, they were closely monitored by the surveillance unit. And when the person developed symptoms, they were tested, and the test result came back positive for COVID-19. That person has since been transferred to Trinidad for continued management. Our 5th positive case was a close contact of one of the confirmed cases of COVID-19 and is also currently being managed in Trinidad. I want to highlight here with respect to masks. So the Centers for Disease Control would have recently published that a significant number of persons who are infected with COVID-19 are actually asymptomatic, meaning that they show no symptoms. And for persons who eventually do develop symptoms, they can transmit the virus to others even before they are showing symptoms. So this means that the virus can spread to persons who are in close proximity, even if someone isn't showing symptoms as yet, so via speaking, coughing, or sneezing. So you would have heard the Minister of Health say, treat everyone as if they have COVID-19. So the key to preventing the spread of COVID-19, of course, is social distancing, and that cannot be emphasized enough. And also, this is where the recommendation came about for the use of cloth face coverings in public settings where social distancing measures are difficult to maintain. So, for example, persons going to the grocery, the pharmacy, banks, etc. Cloth masks will help for people who have the virus and don't know they have it from spreading it. So the new Ministry of Health policy is that persons should wear cloth masks, members of the public should wear cloth masks or homemade masks once they're going out into the public. But this is just to say, please stay home, and only if you absolutely need to, you go out into the public, wear your cloth mask when you venture out into public. So the cloth mask, including the homemade mask, are recommended for use by the general public. The surgical mask and N95 masks are critical supplies that must continue to be reserved for healthcare workers and other first responders. It is highly recommended that the public wear their cloth masks in areas where there's high foot traffic, so persons, as I mentioned, going to the supermarkets, the pharmacies, to the banks, etc. And just to note, persons must follow the recommended procedures for using the mask. So you need to clean and sanitize your hands before putting on the mask and when you take them off. And of course, your cloth mask should be washed and dried thoroughly before reusing. But the use of masks alone are not going to reduce the risk of getting COVID-19. It is still absolutely essential for persons to follow all the personal protective measures, which include washing hands frequently with soap and water, or using an alcohol-based hand sanitizer, covering your coughs and sneeze, avoid touching your face, avoid close contact with persons who are ill, and of course we ask anyone who is ill, please stay home, sanitize frequently touch surfaces, and of course practice social distancing. And a big key to that is please stay home and stay safe.
Thank you very much, Dr. Tiffany Hoyt, CMOH. And now we go to Dr. Victor Vela, Medical Chief of Staff at the Scoville General Hospital.
Right. Good afternoon, ladies and gentlemen. This is just a brief outline of developments at the hospital. First of all, I'd like to point out that the screening and isolation area for COVID in front of accident and emergency has been upgraded to be a little more comfortable for patients and staff. Portable air conditioning system has been installed and couches. We've also seen an increase in activity on the hotline, and that certainly has resulted in a reduction of persons actually coming to the facilities for testing. We have also lowered our threshold for swabbing and testing, and in anticipation of this, there's discussions ongoing with CARFA and the Ministry of Health regarding us in Tobago getting a machine. There's training planned next week for some laboratory staff. The intention is we intend to hire separate staff for this testing that we will eventually be doing in Tobago. Another note is that we've altered or restricted visiting to the hospital. We now have a policy where visiting is only being allowed on the pediatric ward, and that is for one parent only, and on the maternity ward for fathers of newborn babies. All other areas of the hospital we will be implementing a no visiting policy. And the reason for this is to reduce the likelihood of persons who may or may not have a viral illness coming into the hospital compound and exposing patients who are there. Now, even though there's no visiting, you can still have care packages delivered to the ward, and they will be taken to your family members. The other thing to note is that we have upgraded and doing further upgrades to the facilities for showers and changing for members of staff, particularly in the high-risk area. The reason for this is that those members of staff who have worked closely with those COVID-positive patients or suspected patients will be able to have a shower and a change of clothes before they leave the hospital compound. And the reason why this has been put in place is for the safety of the members of staff themselves and also for the public. The public should be reassured that if you see a healthcare worker in public, that person does not have on clothes that they would have been using to treat any positive COVID patients. The other, just to mention again, that was mentioned before, we've provided accommodation for those members of staff who, for whatever reason, unable to stay at home, and that accommodation is available for all categories of staff who aren't able to isolate themselves at home. Last thing I'll just want to mention briefly is the person who did not survive and was buried on the weekend. It really is important to mention that even in death, there is a very significant risk of exposure and contracting the virus. So there are national policies which indicate that the body needs to be sealed in a special bag, and as soon as possible, the body placed in the caskets, and burial should be expedited. Now, this unfortunately would be a very distressing episode for family members. You would not be able to grieve as is normally the case, but one person must remember that we are in a public health crisis, and it is important to safeguard family members, members of the public, and even in death, the body does expose a risk to staff and members of the public. Thank you.
Thank you very much, Dr. Vela. And now we go to the Secretary of Division of Health, Wellness and Family Development, Mrs. Tracy Davidson Celestine.
Thank you very much, Mr. Stewart, and a pleasant good afternoon to the members of the media and also to the listening public, whether you're there in Tobago or Trinidad and Tobago. I want to add to what was said by both speakers before me, that is Dr. Wheeler, who is the Chief of Staff at the hospital, and also our Public Health Officer, Dr. Tiffany Hoyt. Outside of what has been said, there are several areas that we are attempting to treat with currently, and which has been gaining our attention in the Division of Health, Wellness and Family Development. One of those areas has to do with the establishment of a testing facility on the island. And establishing such a facility would give us the capabilities to test and to engage in an approach that would see more persons tested. And if we are able to establish the testing facilities, it will also help us to improve our decision-making time within which positive clients can be treated. What we have done to date is we have been having discussions with the Ministry of Health and also with CARFA, because the current arrangement now is that CARFA will process the samples on our behalf. And so the discussions have started with our counterparts from Trinidad, and I think it's next week Tuesday, we will see 3 persons from Tobago going down to Trinidad to join their counterparts to ensure that we can have a training of laboratory attendants who will help us in preparing to have our lab here in Tobago ready and in good order to facilitate tests. And of course, the training would be carried out by PAHO. We have also been discussing or been in discussions about testing equipment to be put in place at our hospital lab. And I am informed that there are several equipment that will come into the country within the next 2 weeks, and it is expected that one of those machines will be deployed to our island, which is Tobago. And so preparations have started. We will send the persons to be trained, and we're already in discussions to have one of those equipment come to Tobago within short order so that we too can have testing on this island. While all of that is taking place, we are also doing an assessment at the hospital at this point with the aim of improving the level of operational efficiency with a view to bringing the lab up to an acceptable standard of performance. We have had some challenges in that area, and I expect that by the end of the month, there will be an increase in the number of tests which can be performed at the lab at the hospital. And in our Zoom meeting last night at 8 o'clock, the Chief Medical of Staff would have indicated that already they have started the process of procuring reagents, and some Minimal testing is taking place at the lab as we speak. And so efforts have been to improve the standard of performance and trying to bring it up to a very acceptable level, and also ensuring that we have trained personnel so that we not only test to deal with COVID, but that our lab is ready to treat with the demands and the needs of Tobagonians as we go forward. Apart from that, we have been undertaking, doing a stock taking of the readiness of our facilities here to treat with the needs of our population in the event that we have outbreaks such as this one, pandemics, and we have been looking at our different health centers or hospitals or different product offering on the island where health is concerned. To date, we have visited the Mariah Health Center, which is not yet completed. But in our approaches, we have discussed turning the Scarborough Health Center into a 24-hour facility. We will start off on a phased basis where you will see services being performed up to 12 a.m. and then eventually we will have a 24-hour service at the Scarborough Hospital. This fits into decentralization of the services, the health services, but more so within this current period, it helps us to take the pressure off of the hospital as is the case now. And by the end of the month or within the next 2 weeks, we should see those services being implemented at the Scarborough Health Center on a phased basis, so to speak. And I must add that the Roxborough Mini Hospital, the construction continues, and within the not-so-distant future, we will have 2 hospitals here on this island, one in Scarborough with 100 beds, and the other in Roxborough with about 24 beds. I also want to add to the discussion, we have been in discussion with the Chief Medical Officer with a view to ensuring that we are all on the same page where the policy initiatives are concerned and even in terms of the policy statements. And sometime last week, we would have conveyed to the public that we have created separate pathways at the Scarborough General Hospital. I think it was sometime in the last press conference, the CMO would have made a statement with regards to the national policy indicating that COVID-positive patients are not to be treated at any of the hospitals, and we are in agreement with that, except that in the Tobago situation, the reality is somewhat different. Trinidad has several different hospitals which can easily, some of them can easily be dedicated to treating COVID-positive patients. In the Tobago scenario, we have only one hospital. And we would have conveyed to you, the members of the public, that we would have created distinct pathways at the hospital to treat with those who would require intensive care. And you, the members of the media, you would have gone to the facility and you would have seen firsthand that the risk of contamination, the risk of compromising the level of service provided at the hospital is significantly low based on what was established. And so I want to give you, the members of the public, the assurance that the hospital is constructed in a way to create dedicated pathways, to create isolated spaces. The team of doctors and nurses would have come together, they would have looked at the configuration and would have determined that given the realities in Tobago, that the best place to place those who may need ventilation and who would need ICU services is to be had at the Scarborough General Hospital. We have determined a number of other places for those who were in quarantine, for those who are likely to be positive and well. They will be held at the old hospital and also at Trek. And for those who are positive and would require other care, they would be transported to Trinidad. But those who would need ICU services, ventilation, and otherwise will be held at the Scarborough General Hospital in that very isolated space until the time that they can move to the facilities either in Trinidad or at the fort. So we have determined such a system at this point in time. I also want to add that with regards to the members of the public wearing cloth masks, we are asking the private sector in this regard to also make contributions, and we're seeing that that has been happening nationally, and there is a point where those masks can be dropped off, and it's at the TEMA office, and Mr. Alan Stewart will speak more in that regard. Thank you.
Thank you very much, Councillor Tracy Davidson Celestine. Now we invite Mr. Alan Stewart, Director of the TEMA, to now address you.
A very good evening to all. It is very, very important that I make this pronouncement as it relates to what we saw took place a few hours ago in regards to our first responders. By now, it should be quite clear to most of us that first responders will recognize for their efforts through their initiative as frontline workers. You know, as I sit here, many of our colleagues on the table form part of that body that is responding on the front line to deal with COVID-19. And therefore, I think it is imperative for us to recognize these efforts, and I'm very proud to be a part of this Tobago COVID-19 task force team. I strongly feel that this Goliath, or called COVID, that the tip of the spear, which is the health services, are the ones providing that or leading this effort, and therefore our support, even coming from the Tobago Emergency Management Agency and the collaboration with the many first responders, speak well to seeing that come into place where we'll be able to defeat this common enemy. So I just thought I should mention that, seeing that today is that day at 10 o'clock today, we would have recognized that we salute these first responders in their efforts and what they are doing in their fight against COVID-19. As it relates to TEMA, our role is one whereby we coordinate a network of agencies and individuals and also provide the necessary support to all of our first responders and also key agencies that have a pivotal role to play in this agenda. During the week, we began the sanitization, coordinating the sanitization of those rooms that were utilized in our quarantine area. It is my understanding that 50% of the rooms have already been cleaned and ready for service again. And to me, that is an effort that we must applaud as well. And I'm very grateful for those persons from public health who would have thrown their support to getting this job done. Also, over the past week, we would have seen the transfer of patients successfully to Trinidad. We want to thank the Trinidad and Tobago Coast Guard for providing that service. Under these tough circumstances, they were able to provide the service, and those persons, again, who are on the front line and help in this initiative, we really recognize it, and it went through successfully. We continue to speak to the issue of volunteerism. Volunteerism is very important as we muster strength to deal with the onslaught against this virus. And therefore, we want to appeal again to those persons who wish to come forward and make their their services of mass, that can be done at the warehouse at Signal Hill. Those persons who wish to volunteer these efforts or make contribution of these masks so that the general public can have masks to protect themselves and also to protect others. We want to encourage that, and we just want to let you know that between 8 and 4 o'clock on a daily basis, that at the Timor warehouse located at Signal Hill, we are able to collect these donations and have them distributed to persons who will need them as time goes on. So I just thought I should make these points, and I want to again thank the team for the effort. As I said before, this is a team effort. It's an all-of-government approach, and even those in the private and public sector, we welcome the support that we have been getting so far. Thank you very much.
Thank you very much, Mr. Alan Stewart. And now we will open up the telephone lines or the Zoom lines to those who wish to ask questions from the media. Would you raise your virtual hand? When you get in, we ask you to identify yourself and your organization that you represent. The other thing that we'd want for efficiency is that we're going to ask you to ask 3 questions if you do, and so that they can be answered, and then we'll move on to the other person. If you do have more than 3 questions, then certainly we'll be more than happy to come back, but so that we'll give a fair chance. If you have a question, you could send it by WhatsApp, and that number would have given to you in the invitation that you would have had. Keep your questions on COVID-19, please, and what is the state of readiness for Tobago and our activities that we have been implementing. Also, when you get in, silence your microphone. Those who are not asking questions, please. And if a question has been posed already, please forego the question so that we can be able to move on as quickly as possible and not ask a question that has been posed already. So now we open up the telephone lines, the Zoom lines and the WhatsApp. Vern, yes, he is from 91.9 FM. Yes, please.
Yes, hello, good afternoon, everyone. Are you hearing me?
Yes, please.
Right, excellent. Okay, so
Yes,
my question is, in terms of the sea bridge and scanning on the sea bridge, I know Dr. Howard had mentioned before that there were some scanning being taking place on the air bridge. I wanted to find out if there was any scanning to be taking place on the sea bridge, if it has started and so on. And I also wanted to get some information. The deputy political leader in the PDP, Dr. Phoebe Israel, in her press conference raised an issue asking about the number of tests that were submitted. One, if the number of tests were unique tests, and also how many of those tests were actually tested and were tested for COVID, because there seems to be some discrepancy in tests being actually submitted and actually being tested and persons getting responses. She has made a claim that persons have come to us saying that they've had the test done, haven't gotten a response, and haven't gotten any feedback with respect to what the test results were. Those are my 2 thanks.
Thank you very much.
Hi, okay. So with respect to the scanning on the sea bridge, yes, scanning on the sea bridge started last week. It's actually being done both at Scarborough and in Port of Spain. So at the Scarborough port, we got wall-mounted scanners donated by ODPM, and these it's mounted. One at the Scarborough port is mounted where all passengers having to board the vessel will pass through, so all passengers boarding the ferries are scanned. We also have scanning being done for vehicular drivers. This is being done by the handheld scanners. So I'm happy to announce, yes, scanning of the sea bridge is occurring, and like I said, at both ports in Tobago and in Trinidad as well. With respect to tests, when we say we submitted 85 samples to CAFA, these are all unique tests, no retesting. We're just referring to 85 original samples being submitted. For persons who are waiting results, I'd just like to remind persons that we do have a little lag in getting the results because now we have increased number of testing being done throughout the Caribbean. So some persons would be having a little wait for their results, but their results are pending. There would have been a couple of samples that may have been rejected because of certain criteria that were not met. But for the most part, we've been getting results. We've established a mechanism to try and increase the time, to get back the results at a faster period of time. But some results are still pending.
Okay. And I think there was one, they wanted to know the disparity between the tests sent and the tests not done that have been sent. To me, I got that impression from the question.
So I will have to get back to you with the numbers of tests that were sent and may have been rejected. So we can get you that breakdown at a later date.
Thank you.
Yeah,
Dr. Vela?
Yes, I just want to add that in terms of the testing in Tobago, actually, when you work out on a population ratio, in Tobago, we are actually testing 0.0014% of the population, as opposed to Trinidad, where it's 0.0006%. So really, on a proportional basis, as Dr. Hoyt would have said earlier, we are actually testing twice as many patients per population compared to Trinidad. More testing is actually being done in Tobago and continues to be done.
Thank you very much. Elizabeth Williams, TV6. I think Elizabeth, you'll need to go again because your mic was muted. So sorry about that.
You're hearing me now?
Yes, we're beginning to hear you. Yes, thank you.
Right.
Elizabeth,
Thank
you'll-
In addition, what I wanted to know is when was the fifth person transferred to Trinidad? You would have just revealed that the fifth patient was COVID positive patient was transferred to Trinidad. And also my third question is, in light of the hospital tour last week Friday, why was the resident of Mariah, our first Tobago COVID death, why was that person not transferred to Trinidad in an efficient manner for further treatment, even after the acting medical chief of staff, Dr. Victor Vela, would have said last week Friday that the patient was stable?
Thank you very much.
With respect to is an aircraft being looked at, so discussions are being had with Ministry of National Security in terms of bringing helicopter services on board to assist with the transfer of persons to Trinidad. Because that would be the ideal way, well, the only way really, if you have a person who is intubated and needs to be transferred for further ICU care. So those discussions are in place and are ongoing, and processes are in place to get that to come on board. With respect to when the fifth case was transferred to Trinidad, that actually happened prior together when the second case was transferred, because the fifth case, we got the result today, but the fifth case was a close contact of the second case and therefore highly suspected. So that happened prior, and the results were received by the person who was already resident in treatment in Trinidad.
Thank you, Dr. Vela.
Just to answer the question about the patient being stable, the comments would have been made, the person was stable in ICU, but not stable enough to travel. So I was just referring to the person being stable in ICU at that time, but not stable enough to travel.
Okay.
And with regards to the aircraft, from the discussion, there is to be some configuration of the helicopters, and that will take some time, because certain aspects, I understand, must be sealed off and equipped in a particular way, and so that is taking some time. In the interim, we will utilize the services of the Coast Guard vessel where necessary.
Thank you. And when you get through, please, if you could mute your live feed so that we don't get the feedback from your devices when you get through. Thank you very much. We go now to Akin Labi Holder, Tobago Channel 5. If you could mute your live feed so that we don't get. Yes, Mr. Holder. We go now
Hear me?
to Akin
Yes, sir.
Labi Holder, Tobago Channel 5.
Okay, I can be holder to Tobago Channel 5. I have a number of questions, but I'll just ask three for now, like you asked.
Yes, Mr. Holder.
Like you requested.
Yes, sir.
This question is concerning, I don't know who can answer it, maybe perhaps the secretary. Is there a plan for oncology patients who would usually have to travel to Trinidad for treatment? Has their traveling and treatment in Trinidad been affected by the crisis?
That's one. Ask all three one time, please.
Oh, ask all three. Okay, in light of the crisis, and we want to utilize all sorts of expertise available, a number of Tobagonians have expertise to aid in the fight against COVID-19. For example, Dr. Faith B. Israel and Dr. Nathaniel Duke. I know he would have stated that he would assist in any way he can, even though he's abroad. Have you all looked into bringing in these highly skilled personnel to aid in the fight? And my third question would be for Dr. Vela. You said that there would be little chance of cross-contamination. And I wanted to know if there would be a separation of assets at the hospital to deal with the COVID patients and the non-COVID patients.
Thank you. Thank you kindly.
Okay, the first question asked about was the patients who have to, some persons who have to go to Trinidad for oncology treatment. Now, we do have an oncology unit in Tobago that does provide chemotherapy. What we don't have is a facility to provide radiotherapy. Now, since they have introduced the travel restrictions, some of those persons may be affected, but I am not aware of personally if anyone has been. If you do have information on any patient who has been affected, if you can let me know that otherwise, or you can let them know that they can contact me in the medical chief of staff office to see if we can make arrangements, because usually we will facilitate those patients with a ticket to go down to Trinidad. But since the oncology unit has been put into effect, there's really very few people who have to go to Trinidad for treatment. The question on...
The separate assets.
Separate assets, yes. The ICU that is set up to treat COVID positive patient is in a separate physical building with its own beds and own ventilators to provide care for patients. The medical ward has its own beds. The medical ward, we don't have ventilators on the ward. But yes, the physical assets are separate.
And the third question about bringing in the resources, the skill sets of Faith B. Israel and Dr. Nathaniel Duke.
As is required, at present we have a COVID task force team established with different skill sets. And the team is now responsible for ensuring that we have the systems in place and also for ensuring that we deploy and redeploy the human resources that are required to treat and to fight with the COVID pandemic that is in front of us. If there are gaps in the system and we require more resources, whether it be human resources or otherwise, we will then determine what and how we will deploy those resources. As it is now, there are persons who are outside of the team and who may have expertise to bear to the process. We have been taking their views into consideration in terms of our planning approaches.
Thank you. Whitfield Turner, I-95.5 FM.
Yes, good afternoon to everyone. I just had two questions, basically taking off on what would have been stated in one of the questions earlier. Notwithstanding all the modifications that would have been done up at the hospital, was any consideration given at any time towards establishing a field hospital to deal specifically with COVID matters so as to completely eliminate the concerns about cross-contamination, and also for Secretary Davidson Celestine, can she provide us with a date as to when masks will be made available to the public, and how would the distribution process be? How can persons go about getting those masks?
Well, in terms of the distribution of masks to the public, I am echoing the sentiments of what was said nationally, and there was a call for the private sector to make contributions to masks, basically. And I'm also echoing that call at this point in time, and for the NGOs, those artisans in the communities out there, we would have established a drop-off point, which is at TEMA. And so I am encouraging and imploring that we have that kind of contribution from the wider public out there, those cloth masks that are needed for us.
So with respect to the first question about looking at another health facility, we did do a tour with the Secretary for Health on several possible health facilities outside of the current Scarborough General Hospital. We looked at the old hospital, we looked at Mariah Health Center, another team looked at the current Scarborough Health Center. And what it was, the assessment was in terms of what is immediately available to provide care to patients who are COVID positive. At the end of that exercise, it was determined that the current Scarborough General Hospital at Signal Hill, because of how it was constructed with the wards being physically separate and easily separated, it was determined that at this point in time, the best place to manage COVID positive patients would be on the current hospital site, but actually physically separate from the other departments in the hospital. The Secretary would have mentioned the Mariah Health Center is at an advanced stage but not yet completed. The Roxborough Hospital is not yet completed. The current old hospital at the fort is just that, an old hospital. The amount of work that would be required to bring it to a functional state would be major works that will take months, possibly even a year or so. So when the assessment was done, we had to decide, or the team had to decide, what was the best location to provide almost immediate care that will require minimal adjustments. And it was the Scarborough General Hospital at Signal Hill was the best location. These consultations also involved the ministry, the chief medical officer, and other colleagues in Trinidad before we arrived at that decision.
Mr. Chair, this allow me to make clear exactly where the location for the donations of masks can be dropped off. So it's important that the public know that the location, the disaster relief warehouse, let me mention that again. The TEMA Disaster Relief Warehouse is located at Signal Hill, just adjacent to the Trinidad and Tobago Regiment, or what is known as Camp Signal Hill. So persons wishing to make those donations, you are asked to make those drop-off at that location between 8 and 4, probably until we can make better arrangements for other drop-off sites. Thank you very much, and I look forward to your cooperation.
I think there was another part to that question that asks about distribution process.
On a first-come, first-served basis, and in high traffic areas, those who are exposed to high traffic areas, perhaps the banks, the supermarkets, so to speak.
Okay. All right. Thank you very much. I know that we have some follow-up questions from Vern and also from, I think, Akin Labi, but let me just get the question in from 92.7 FM from Clayton Clark. He is asking, who are the members of the COVID task force?
Well, I will share the list with you at a later date. Thank you. But there are several members, including TEMA. We have the chief medical officer. We have the county medical officer. We have Dr. Maria Dillon Remy, who is on as one of our coordinators. We have Dr. Solomon and representatives from the Division of Education and Innovation. We have a representative from Tourism and Transportation, and quite a lot of others. It's a multi-sectorial team, and I will share that list with you at a later date. Thank you.
Also, Cuban doctors, would we be considering Cuban nurses, working in Tobago? Is that an option being looked at?
Yeah, we already have Cuban nurses and doctors working in the hospital, and I know that a request was sent to the ministry for any additional Cuban doctors or nurses that they may be bringing in. Yeah. I've been told that there may be some nurses coming in, but they did indicate that at this point in time, no Cuban doctors, because they are still unemployed doctors in both Trinidad and Tobago that we are in the process of recruiting first.
Thank you. Cassandra Forbes.
Good afternoon to the panel. I have 3 questions. And in relation to there is the advice that cloth masks can be used at this time. Can you give any specific guidelines as to how those masks should be made and used for the public? That's 1. 2, I know having spoken to Dr. Wheeler last Friday, he spoke about different patients and the different levels of for COVID positive patients. But just for the benefit of the public, can you give us an idea of how maternity patients would be dealt with? My 3rd question is to Secretary Tracy Davidson Celestin. In light of the COVID-19 situation occurring right now, we know we have a political situation occurring where there is supposed to be a changing of the guards by the end of this month. Will that still be in the cards?
Well, we have to determine how that fits into the COVID-19 at this time, but I will leave that to the Secretary to determine. So the other questions, maternity patients, yes. We'll go to Dr. Wheeler.
Right. So yes, so as was said before, persons who are COVID positive and well, we will be able to isolate at TREC. However, pregnant patients, the Port of Spain General Hospital has actually been identified as the maternity unit to look after COVID positive pregnant patients. If we do have a pregnant patient that is positive, we do have an isolation room on the ward where we will house that patient while we make arrangements to transfer that patient to Trinidad.
Okay, and there's another one on the use of masks. I think they want design.
So with respect to persons and the cloth mask, there's actually the division's Facebook page. We've shared information how you can do your homemade mask. So there's a how-to, as well as the guidelines for when you're using the mask, such as making sure that you sanitize and clean your hands before you put them on, and of course after taking them off. And when you're reusing the mask, make sure that you wash and dry them thoroughly before reusing them. So persons can go to the division's Facebook page to get these guidelines.
Thank you very much. And many other things you will find on the Facebook page of the division that would help. Yes.
And in terms of the question to me, I am sure I can give you the assurance that before the end of the month, I will come back to you again with regards to the political situation and the arrangement that is to be made.
Thank you very much. Vern Extravor, 91.9 FM.
Sorry about that. Right, just had to unmute my mic. Good afternoon again. Just, I'm sure maybe we may not have somebody to answer this question, but I need to have it ventilated here. The question of school feeding that needed to be addressed at the various schools. I got a phone call from someone who would like to remain anonymous because of their position, but would like to get some clarification on the process in Tobago with respect to accessing support for children who would have been taking the school feeding program. As far as they have gotten information and gotten some feedback from 3 parents from four different schools, have said that the Division of Education has been asking for a specific number from each school or class or something to that effect, when in truth and in fact, the number of persons that would have accessed the school feeding program may have been closer to the 100. The division had been asking for just 10 or 12 names from each particular school. Is there anyone on the panel who could give guidance in terms of getting this situation clarified so that persons could make some kind of way forward to get the assistance? And there are a number of persons who also want some help in accessing some sort of relief. One in particular, a PH driver, said he has a P vehicle and thus cannot access any grant funding. Is there any response for him in Tobago?
Well, let me answer that question by saying that the secretary in the Division of Education and Innovation, that is the current chief secretary, has been working with his team to identify those persons who would require that level of support. And yesterday at our executive council meeting, he would have indicated that there are almost 1,000 names that would have been put into the system to obtain the food cards. If there is anyone who believe that they qualify in terms of the criteria that was set, I would ask for them to contact Ms. Sherian Rollox, who has been coordinating that on behalf of the Secretary in the Division of Education. But I know that the list is being processed at this point in time, and that those cards should be given out in the not so distant future, I would think, by very early next week. By early next week. Is there another question?
No, that was it. Did Mr. Akinlabi get his follow-up question? Akinlabi, you still have a question that you wanted to follow up with? And then we'll go to Elizabeth Williams, TV6.
Dr. Vela, you said that there will be a separation of assets, but I want to know if that will involve a separation of personnel as well. Secretary, I know all around the world a number of Cuban doctors have been going to different countries to assist, as the Tobago House of Assembly looked into reaching out to Cuba for bolstering of professionals. And also Dr. Hoyt, I know you all would have stated that because of the situation with Tobago, results take a while to come back, a little longer to come back. But with the setting up of the lab, how long would you think the wait time would be for results?
All right. In terms of the approach to have Cuban doctors here in Tobago, that is a national arrangement. It has to do with government to government. As would have been indicated by the Minister of Health, there was that arrangement, and there are Cuban health practitioners who have come into the country, but who I believe are under quarantine at this time. As I would have indicated earlier in earlier press conferences, if there is a need in the Tobago situation, we will request, and those personnel assets, whatever it is, would then be deployed to Tobago as we speak. We made a request for ventilators. We have been requesting different stock. We have been looking at setting up testing here on the island, and all of those requests were sent and are receiving active consideration as we speak. I spoke earlier about the establishment of the lab at the hospital to ensure that we have establishment of testing, and our personnel will be sent to Trinidad next week to be a part of the PAHO training, and we are waiting the arrival of the equipment into Trinidad and Tobago. I understand that it may come within the next week and a half to 3 weeks. And so it will only be set up, it can only be set up when we have the training done and the equipment coming into the country.
Right. So just to follow up with respect to the separation of assets, separation of persons. So for example, the screening and isolation COVID facility in front of casualty, we have separate staff that will manage that isolation facility that don't work in the rest of casualty. If we have a patient in the ICU, that is the COVID ICU, we will have staff that will only be working in that ICU but will not be working in the normal ICU. So if there's a patient there, we will not have somebody who is looking after a patient who has been ventilated in the COVID ICU and then have that person go across to the normal ICU to provide care. That will not be the case.
Thank you. Thank you very much. And I think there's a last question that I saw that Mr. Whitfield Turner would like to ask, and so therefore after that we'll do the wrapping up. Mr. Turner?
Yes, I do believe Liz also had a final question as well. But to take off from where Dr. Wheeler just spoke, in terms of the donning and doffing area for the COVID personnel, the nurses and so forth, is that located in an area that would allow for those persons to go through that process and then shower without having to come into a general area of the hospital? That's one thing. And just to follow up on the issue of the mask, what's happening is that persons are at home because they're told to stay at home. They don't have masks, they don't have the capacity to make, but they would like to get. And they're trying to find out how do they go about getting. Is it that they have to call a particular number and then have it delivered to them, or do they have to go to a specific place to collect? That's separate and apart from the high traffic areas like banks and so forth. And finally, this situation also puts a strain on the mental health aspect of the workforce. Do we have sufficient personnel in that particular area on island, or do we need to boost our numbers in that respect, especially to try to avoid having burnout of mental health professionals as we have them right now?
Thank you. Dr. Wheeler, donning and doffing?
Right, yes. So, for example, the ICU, the new ICU that we have constructed does have an area for donning and doffing. Within that same separate facility, there are changing rooms and showers within that facility that would allow persons to change, shower, and when they leave the unit, they can go out. There's no interaction with any other member of staff in that particular area. For the screening and isolation unit out front, there's also a separate area for donning and doffing, where they would not be mixing with other members of staff or the members of the public.
Could you just, for clarification to those who are not medically inclined, donning and doffing?
Donning and doffing is it's the putting on of the PPE in a particular way and the taking off of the PPE. Because it is a very meticulous process, putting on the gloves, gongs, face masks, and then when you take it off, you have to take it off in a particular manner that you don't contaminate yourself. That's just the medical term used, donning and doffing.
Thank you. And then the one about the accessing of the, I know that question was posed already as to how we do it, those in high traffic areas, etc. I don't know if there's anything else that we wanted to add to that.
No, where the COVID treatment area and ICU are located, that's actually blocked off from the public. And there are clear signs identifying no entry. So those are not high traffic areas at all.
Okay. Mental health capacity?
So yes, Persons can look at the division's Facebook page and you can get the numbers for, there's a hotline for persons who need psychological support. And it would list, according to the area that you're in, the number that you access for persons who need that support, the psychosocial support.
And he was asking whether they had enough on the island.
Oh, yes, definitely. Definitely.
Okay, thank you. I understood that we did omit Elizabeth Williams from TV6, so therefore we'll take her now.
Good afternoon, Elizabeth Williams, TV6. In terms of food cards and grants, what we have been told is a number of citizens in Tobago have been complaining that their businesses, in terms of their employer, their businesses are closed and they are not getting employers to sign these documents. They are wondering what to do. In terms of grants and food cards, we have also been told that persons have been visiting the Victor E. Bruce complex to acquire food cards and they are being turned away. We would like to get a comment on that. In addition, I know Madam Secretary Tracy Davidson Celestin, Health Secretary, would have stated that there is $53 million with respect to the budget for COVID. Has this been increased? And with respect to that budget, suppliers and contractors attached to the Division of Health are wondering when are they getting their outstanding monies? Have these monies already started to be paid out? One contractor is owed over $2 million. And my final question, cancer patients attached to the oncology unit were recently turned away in terms of accessing chemotherapy in light of COVID-19. They are concerned and wondering if there is a staffing issue at the oncology unit.
Thank you very much. All right, so we take food card.
With regards to the situation at Victor E. Bruce, quite a lot of persons have been going to that particular building with the hope of accessing a food card. You have to be aware that we are discouraging at this point in time persons gathering in public places. And there is a rule and regulation now that you should not have more than 5 persons. The secretary in the division would have indicated that online persons who so deem as needy at this time can access those forms. And so we are encouraging the members of the public to now apply for those forms online as opposed to lining up at the Victor E. Bruce building to access the food card, so to speak. In addition, we have online at the Division of Health and Social Services application forms as well, and we are inviting the members of the public to use the online portal as much as is possible, as opposed to congregating outside of public offices. There's another question on food card. Which one is it?
Yes. The oncology?
Yes. So yes, there was a temporary disruption in the ability of the oncology unit to function, but that has been rectified. We did have to redeploy some of the doctors from various departments, but a replacement was sought, and that replacement has been supporting the unit in being able to continue with its services.
And I wish to remind the public that to date we have employed 9 doctors, is it?
Yes, we have supplemented the medical staffing, replacing doctors who left, and also supplementing the COVID screening area. And the health centers have also increased their staff, and we have a couple more doctors to come on board to boost our human resource capacity as we fight this public health crisis.
And I must also add that with regard to your question of the 53 million, that is what is allocated at present to treat with the COVID situation. And outside of that, discussions have already been held with the secretary in the Division of Finance and the Economy with a view to ensuring that monies can be put aside to pay outstanding debts owed by the TRHA at this point.
Thank you. And I think that would take now all the questions. We'll ask Councillor Tracy Davidson Celestine to do the wrap up, and then we'll do a formal thank you.
All right, so thank you very much to the members of the media for your questions, and to, of course, the listening public. And in closing, I want to use the opportunity once again to commend and to congratulate all of our frontline staff, all of our healthcare practitioners who are out there working on our behalf and who are working basically around the clock. We, of course, know that this is a very stressful time for you, given, what we are seeing in the world today, given what we are seeing in the Caribbean. But I want to give you the assurance that your heads within the healthcare fraternity, as well as the Secretary and the Tobago House of Assembly, would provide the resources, would provide the necessary support so that you can get the job done. Earlier, while we were on our way to the press conference, I had a discussion with the Chief Medical Officer in terms of the stock of PPEs on the island at this point, and I can safely say that we have over 11,000, more than 11,000 of PPEs and N95s and in stock at this point. I continue to advocate to your heads that they must have regular meetings with you, members of staff, so that you can have the ready information and so that we can, as much as possible, allay your fears, and I know that is ongoing. So I really want to use this opportunity to commend and to congratulate and to advise the public that we are to treat our health practitioners at this time with love and concern. I am getting quite a lot of reports of discrimination of our healthcare staff, and I'm asking you, the members of the public, to be understanding as we continue to fight this fight of saving our lives. We have put aside facilities for those healthcare practitioners who cannot now go back to their homes because of situations arising. And the point I'm making is that we are continuing to ensure that our healthcare workers are taken care of. While all of this is happening, we are also assessing the systems at the hospital as we speak, and along with the team, the Chief Medical Officer and the other respective members who provide support at the hospital, we have been looking at how we can bring the systems up to speed as quickly as possible so that we can provide better health care to the members of our public. So all the labs, all the shortage of staff that we would have had maybe over the years, dealing with outstanding payments, gratuity, those are the things that are taking our attention as we speak. And as I would have indicated, the discussions have already started with the Secretary of Finance and Economy to ensure that we can have a ready supply of money to treat with all those outstanding payments within the shortest possible time frame. Again, to the members of the media, I am asking you to not become complacent. The stay-home regulation has been extended to the end of the month, and that is for a particular reason. We want to ensure that we flatten the curve as much as is possible. We want to ensure that we contain the spread of this disease as much as is possible, and we're asking you to give a consideration to all the rules and regulations as they come to the fore. And in this particular instance, we are saying that if you have to go out, please ensure that you wear your mask, especially in areas that can easily be considered high risk. The Tobago House of Assembly and the central government would have determined and established several support programs for those who will be disenfranchised at this point in time. All you have to do is to try to access the services online. I know there are members of the Assembly at this point who are assisting their constituents and provide the information, and the support will come. Thank you and all the best, and we will report to you again next week in terms of what we are doing with regards to the health sector and how we are working towards improving the level of service on your behalf.
Thank you very much, and we want to really thank all of you for being so supportive of what we do and lending us all the help that we can get. I want to thank the staff of the Division of Health, Wellness and Family Development, particularly the communication unit headed by Mr. Rion George, who is the Senior Corporate Communications Officer there, and his team. I want to really thank all the entire staff of the division in the various areas. Also the Tobago House of Assembly, because the task force comprises of people in other areas besides health, and so therefore we want to thank the Tobago House of Assembly for all their support and the input that we have. The members of the presentation team today, we also want to thank you, and just remember, enjoy this wonderful weekend that you're going to have for Easter, and stay home, stay safe, save lives. Thank you very much.